This is an amazing environment to do research, to do clinical work, but in particular, this is an amazing environment to do translational integrated work. So by designing our group, we don't have people carrying a clinician's hat or a scientist hat. We have a single hat, that's a clinician-scientist hat, and that's not an oddity in this environment.
The level of expertise and resources and commitment to discovery and translation is unlike anything I think I've seen elsewhere.
I was doing some work in a women's shelter, and so I was learning the stories of these women, and women who say they've been thrown off porches or strangled into unconsciousness or headbutted. And to me it seemed obvious. I was like, wow, these women must be sustaining brain injuries. And there wasn't a single paper addressing this topic, not one. Mass General, people are very receptive to this idea of basically studying this population. They respect this question that I'm asking. They understand the value of it.
We have so much overlapping expertise across these areas and so much interest in working together to solve these complex problems that I think we are uniquely well positioned to be able to approach them and to solve them in a way that no one else will be able to do.
It is a bit what Albert Einstein says, and that is, with every difficulty lies opportunity. And the opportunity is, let's push patient care forward here. Let's come up with something innovative around the treatment of that.
Can we leverage large-scale data that are now available in the realm of neuroscience, genomics, electronic health records to improve our ability to diagnose, detect, and treat psychiatric disorders and serious complications of those disorders?
We're looking at frequent marijuana users and how they learn. And what we find is that if they stop using cannabis, they learn better immediately, within a week of stopping. And that's been really surprising to us, and I think it conveys an important public health message as well.
By working together, not only do we help our own patients in psychiatry in terms of understanding the biology of their illness, developing markers for that biology and new treatment approaches, but we also have the ability to offer to our colleagues our way of thinking about the brain clinically that is holistic and comprehensive, and potentially would bring things in that other disorders that tend to rely more on biological markers might be missing.